Hey everybody, we are live. Yay! I'm always so excited to be here and be live with you guys. You know, it's my favorite time of the week. We get to hang out with some of my favorite people. We drink a little bit of coffee, we do a little bit of talking. This time I've got a really bright light here that they bought me so that I could look nice. So you can see, I hope I'm coming through nice and shiny. I am beyond excited for today. You guys, this over here, I guess she's over here to me now, is Dr. Erica Barron. She is brilliant, beautiful, my friend, so fun. She is a podcaster. She's got a book. She's got it going on. So she's hanging out with me today. She's hanging out with you guys. We're talking cat acupuncture, and I couldn't be any more excited about this conversation. Probably you can tell I'm screaming. Sorry, I will land the plane. Hello, Dr. Barron. How are you?
I'm good, Becky. Thanks so much for having me. I wish I could have you in my pocket anytime I need a boost. You're so kind. Thank you.
A little pocket Becky. Oh my gosh, maybe we should trademark that and I would come out.
Polly Pocket is Becky Pocket.
Becky Pocket. Hey, Anne Marie. Thank you, Haley. I appreciate the birthday wishes. You guys know what to do. You know to put the comments over there. I'm excited to see my friends, excited to have this conversation. I appreciate you guys so much. So let's get rolling. Dr. Erica, what is new with you? Podcast, book, practice, COVID. Catch me up.
Yeah, so there's a lot of things that are happening right now, just like for everybody, right? But the nice thing is so I work 3 days a week at Nova Cat Clinic, and then I work 2 days a week for myself, and I do house call acupuncture, so I can still see big dogs that can't get up and move. So because of COVID, I've been listening to what my clients need. I've been calling it porch poking, where I'm on the porch with the dog and some needles, and the clients inside, which is fine. Luckily, most of the days have been cool enough or warm enough or whatever. One of my clients was so kind to put a little heater out there one day when it was really cold. And we're just going. Having 2 kids at home during this has been interesting. And luckily clients have been wonderful. I wear an N95 mask and I bathe in Purell multiple times a day.
Yeah.
And so far we've been okay, thank goodness.
I haven't actually probably said it on here and said it enough, but thank you guys. Thank you for being frontline. Thank you for continuing to care for pets, continuing to keep health for them, even in front of health for yourself. And obviously you're taking care of yourself and your patients, but you're finding ways to keep clients and yourself safe so that you can continue doing medicine. And so thank you for that. It's super important. And even if not, especially acupuncture, because we reach a level, like a base level, and you really want to keep that up. And the idea of losing months would be such a bummer. So I'm so amazed that you are doing that. Now, before I get into 100,000 questions that we have for you about acupuncture, tell us about your podcast.
Oh, so we have a podcast. It's out there and hopefully we'll have more soon. It's called The Litter Box. It's me with our head technician over at Nova Cat named Ellen Carosa. You might know her on Instagram as the Cat LVT. She is the go-to for any questions about neonatal kittens and cat care. She's one in a million, and I'm really lucky to be around her. She's a wealth of knowledge, and I think our banter is pretty good. I'm sort of like the calm, cheery, happy one, and she's the give it to you as it is, very direct. And there's a lot of cases we've worked on together over the years that have been published. Like there was a cat who just with cold laser we cured MRSA. There was a cat that after she had her babies, it's funny like how you learn certain things when you're in vet school or even like studying for boards, and you're like, I'm never gonna need to know this. I'm never gonna need to know that cows can hit this, like when they calve, they hit this nerve and sometimes they get paralyzed. Like I'm never going to need to know that. Well, it happened to a Maine Coon. And for some reason I remembered that. And we were able to fix her with the laser, which was fantastic. And that was published too. So just working together and also being here at Nova Cat and being in such a dynamic environment where we all work so well together. And I can honestly say I love all the doctors I work with. They're phenomenal. I trust all of them with my own cats, and I would trust all of them with all of my patients at any time because I think they're wonderful. So I'm excited about that. And then my book that came out is called Needle in a Haystack. My husband came up with that name, which was great. He's very creative. And it went #1 on Amazon. So that's really exciting too. And that's just kind of like how I got to where I am. And also, you know, the pets along the way that helped me get there. So it's for people who want to learn more about acupuncture, for people who maybe don't believe in acupuncture and that it works. And it's also for people who just like some good animal stories.
What gave you the idea to write the book?
So I've been thinking about it for a while. And I also was thinking about just a way for people to kind of hear other types of stories. There's not lots of books out there about things that happen with acupuncture. And as I mentioned in the book, all the things that I've seen happen with acupuncture, if you know traditional Chinese medicine, it's not surprising. It's supposed to be like that. But it's amazing. I've stopped a seizure with one needle. Like, that's, to me, like, I've been doing this for a while and I still love it. You know, I had a dog 3 weeks ago who couldn't walk, and she was holding her back leg up and she was crying in pain. And I got a text from her owner on Monday of a video of her running. See, my nose is getting red. You know, she's running again.
Yeah. Quality of life, right? Quality of life. Because we know when we cannot traditionally medically treat these cases, when medicine stops working, when an additional therapy is needed, it's this or sometimes loss. Like, it's like if this doesn't work, we're at the end of the line. And then that's a lot of pressure for you.
Yeah, it is. And also you feel like you failed.
Yeah.
And that's one of the things I think for a lot anymore. I feel like it's that it doesn't always work. But when it does work and it helps, it gives you something else to try. And there's I could tell you so many cases where people were giving up.
Yeah.
And we tried, and the pet got another month, or the pet got another year, or I never saw it again because it was magically fixed.
Yeah. Okay, so let's jump in a little bit to that and just start to get to the nitty-gritty here of acupuncture for pets, and specifically talking about cats because that's our audience. Mm-hmm. What are the types of things you use acupuncture for? What are the treatments? What are some people who like perk their ears up and say, oh, like that might help my cat? What are some traditional things you're seeing?
Mm-hmm. So that's a great question. So in cats, we have a lot of opportunities for ways to treat pain. But remember, cats are a species of prey and predation. I work at a cat clinic 3 days a week. Like, I get it. Like, that's part of why I love cat medicine, because no two cats are the same ever.
Yeah.
None of them read the same book. In fact, they read it and threw it out because they disagree. And you have to treat the patient. It's never about treating the disease in cats, because there's no cat that will take 15 pills a day. And if there is, you should make sure that it's actually a cat and it doesn't have a feeding tube in it, right? Because cats aren't going to do that.
Right.
So it's so interesting, especially as they age, how we start giving them more things and more things and more things. And sometimes they won't take it, or sometimes their blood work doesn't let them. So my favorite thing to treat cats for are those old crunchy cats who all have arthritis and kidney disease. Because in traditional Chinese medicine, the kidney is in charge of a lot of things that happen at the end of life, including your bones breaking and you pee a lot. So the kidneys in Chinese medicine are in charge of treating for arthritis, and they're also in charge of kidney disease itself. So there's a lot of cats who fall into that category. And if they don't have kidney disease yet, they're probably getting it because they're cats, and most cats get some form of kidney disease during their lifetime. So it's something that I really enjoy treating them for. Any type of pain is really great. A lot of times, some people have found success with treating liver disease. Liver disease in cats is really frustrating. it's like one of the most frustrating things to do unless you put a feeding tube in, because they need so many meds. Yes. It's just how it is. Yes. So it's another way to treat them. And cats with pancreatitis, because pancreatitis is kind of this nebulous of like, why do you have it? This is frustrating. Why are you in so much pain? I had a cat years ago that we could only cut through his pain from pancreatitis on fentanyl. And it was like, why do you need fentanyl, Casey? It's like, why is this making you so painful, you poor guy? So I treated him with acupuncture, and it really helped him come down faster from that pain and that pancreatitis flare-up. So that's something else to consider. And those are the things I usually think about. So again, if you have a cat and it has arthritis or kidney disease, you should definitely find an acupuncturist. If it's not eating, if it feels just blah, sometimes they can help. There are some people who don't have a lot of success in treating GI disease with acupuncture, but for some cats, that works really well. And then the last thing that I haven't mentioned yet is cancer. So acupuncture is wonderful at treating pain, and a lot of cats that are cancer patients not only have pain, but they also have, just different types of parts of the disease happening. So there are some cancers that can be either halted or treated with acupuncture and herbs. It depends, but that's something to talk with a local acupuncturist about.
Right, because it's going to be up to your cat. So that makes me, look here at this question that one of the questions we've got, and we're going to kind of answer as many as we can and hear from you. But Susan was asking, what are the average number of visits? So as you're talking about these different conditions, and I know you kind of said like for some, one and it's done. What's the average treatment process look like for these more chronic conditions? Is it all the way through? How do you make a treatment plan? And again, we know addressing the cat in front of you.
Right. So the way I do my appointments is I usually say, expect to see me 4 times, 4 weeks in a row at first. That's because we're going to see if anything even happens. Because sometimes it took a while for the body to get like this, and it's going to take a little bit of time for us to try to get it back. So I usually say, especially for arthritis and kidney disease, expect it to take at least a month. There are some things like, I know this is more of a dog issue, but I have seen this happen in cats where if a dog or cat is leaking urine, sometimes that only takes 1 treatment or 2. I usually do 2 because I'm like, oh, let's just try it one more time just to make sure it sticks. So it depends, but usually for some of my patients, I start seeing improvements after the first treatment. It just depends on the disease and the cat. So there's certain types of cats that fall into different parts of the traditional Chinese veterinary medicine scheme or the 5-element theory. And there's certain people, just like there's certain pets that fall into this scheme that are more susceptible. So for example, I'm very fiery. I like to talk. I'm emotional. I like to be happy. I don't always, but I sort of have the personality of a Pomeranian. I'm either on or I'm off. I tend to be happy. I like to be around people. Because of that, I am very, very, very susceptible to acupuncture. I was receiving acupuncture a couple years ago, and it only took 3 treatments for me to get pregnant. So
wow, yeah.
I was pregnant within a month. So
wait, that's not how acupuncture is supposed to work.
I know. Most of the time, it was funny. My acupuncturist was like, "Well, I worked well," and I was like, "Yeah, I think I'm a little fiery." So
I'm teasing. You don't get pregnant from acupuncture. No, there's other things involved there.
Right, but it made me more able to get pregnant.
That's so amazing. Mm-hmm. I went to acupuncture with no expectations, just kind of wanted to see what it was about. And it made my ears drain. Like I had a lot of like ear and sinus inflammation that went away. That was like, I didn't expect it. And it was really the place I noticed it the most. And, it's unfortunate we can't have our pets tell us what happens, but I know anecdotally what I've seen is amazing. And at the ASPCA in the shelter that I've worked in, they do a lot of acupuncture with some of those dogs. And I think that, dogs and cats, and I think that with our pets, it's how we know it's not placebo, right? Because when you see these improvements, And then you even see like the decline and say, oh, it's time for another treatment.
Mm-hmm.
And then you see, right? So how does it, that cycle works different for each pet, but there's no placebo. Their response is their response. But I'd like that you say it may or may not work. Like it doesn't work for everybody. I want to ask I want to talk through the process here a little bit. So I want to start with one of Anne Marie's questions. So she wanted to know, when you start, is there a point that you use to calm treats before you get going? Or like if you have an anxious pet, are there points to treat that to help them, get through the session better?
Yeah, so it depends. Usually at my first visit, especially if I'm at someone's house, or even if I'm at the clinic, we have what we call the comfort room, which has a couch. It feels a little bit more homey than just a regular exam room. And I kind of just let the pet walk around while I talk to the owner and I stare at it just so they can kind of get comfortable. Usually even anxious pets, I find that if I keep myself in a calm place and I really start trying to make myself calm and relax and think positive things about the pet, 9 times out of 10, the pet picks up on that and just naturally relaxes. Now, there are some dogs and some cats that are just like, we don't really care what she thinks. So I do always start, 90% of the time, I start my treatments with something called the governing vessel 20, which is right on the top of the head. It's the 100 meetings point. It's the closest point to the heavens in most species. And it's supposed to do 100 different things, including give permission for the treatment. My mentor, Dr. Jane Morse, used to call it the Merlot point, because for some of them, it just kind of zens them out. Some pets, what I do is I kind of go real fast and I just go, with feeling the right points. I just don't throw needles and things. And sometimes I put a bowl of treats out and I do it and then we relax. Some pets, depending on the type of pet, some collies and some more metally dogs and cats that really like order and structure, you have to kind of go slower because they'll let you know when that was the last one. It's like they look at you and you're like, okay, we're done. That'll be enough. You sort of, whenever I do a treatment, I kind of have an idea in my head of what I think is the most important thing, and I do it in that order. Just like if you were in a clinic and you were dealing with a pet that was a little sensitive, you would say, okay, blood work's more important than radiographs here, or, I really need the blood pressure first in this pet. So it's just diagnostically putting things in order.
Sure, because while it is not, traditional Western medicine, it is still medicine. It is still looked at as a treatment, and it is still something you approach as a practitioner, and you create a treatment plan. No different than if you were in Nova Clinic dealing with your medical patients who are dealing with upper respiratory viruses, right? Like you have a treatment plan no matter what, and you're treating the patient in front of you. So then let's talk a little bit about what you're doing for the treatments. Anne Marie also wanted to know if you're using cold laser, because you mentioned using cold laser. Do you use that for the acupuncture points themselves, or only the needles, or how do you approach stimulating the points?
Yeah, so what I do, and that's a great question, thanks Anne Marie. What I do is I just use acupuncture needles for the treatments, and then I will use cold laser on top, sometimes while I'm doing it or after. I was traditionally Chinese medicine based. So even though I know that cold laser does work and a lot of people use it for acupuncture, I only used it once or twice and I didn't really see results I appreciated from that. So I still, if I sort of feel like if I can't throw the needle in the pet, then there's probably a reason for that. So there was one pet I couldn't throw needles in, and then I used cold laser on her, and this was like 5 or 6 years ago, and she didn't respond, and she was pretty sick, so I think things were a little too far gone at that point. But I just use needles, and then like depending on what's going on, I will cold laser on top of it or after, depending on the pet.
Okay, I mean, and I think that makes sense, and we can appreciate that. So let's talk about the needles, because, and I'm not going to lie to you guys, I'm honest with you all, my feelings got hurt. We posted about this, and I had people come back and actually say they felt like this was animal abuse, and I was like totally devastated. So I wanted to kind of address a little bit of that. Like, I don't know, just sort of like, for example, it'll never happen to my cats. Yeah, I see animal abuse written all over it. No conclusive evidence that this is effective in humans, so why would we subject our pets to it?
So that's wrong. There's a lot of evidence. Just go to the NIH. You could go to my website, which is acuvetforpets.com, and there are lots of studies that are posted that it is effective. And then my question back to you is, there's other things that we don't have any evidence for, and are you doing those? We do not have lots of evidence for massage. We do not have lots of evidence for CBD. So if you are saying that about acupuncture, then I hope you're not doing one of those things. Sorry,
yeah, and
I got a little defensive.
No, I want you to get a little defensive because we mean it in a loving way, and this is how we have the conversations. But I got defensive too. Like I said, my feelings were really hurt because again, I was like, but there's tons of evidence. There's lots of evidence, and I've had it myself, so I've experienced it, and I've seen the pets where again it can't be a placebo. And then even more of that, we got. For example, I've seen it work miracles on extremely sick neonates. So much so that I want to try acupuncture for myself, which I think is beautiful because usually it goes the other way. Like, oh, I tried acupuncture, so I thought I'd do it for my pet.
Right.
With the neonates, what are some of the things we would use in neonates for, and how is it helpful?
That's a great question. So some of the things I've done in neonates was to try to help regulate their temperature. So if they're too hot or they're too cold, we can help with that. We can also use moxa, which is a burning herb that helps regulate temperature as well, helps with GI stabilization. It can help with infection. It can help with GI motility, which is an issue with a lot of neonates. It can help with immunity, which all neonates need help with. It can also help, like if one of them is paralyzed or having issues with their, like we've had a couple kittens where, if their tail was slammed in the door or, they fell and they're really painful. All of those things can help. Also, there's emergency points right here and in other places that can help sort of bring them back when they're trying to crash and burn.
Yeah, I was going to say I've used that as a technician on my neonate puppies and like just some of my really sick kids and it works a little teeny tiny 25 and like a little zoop zoop and it's amazing. I mean, am I talking about the right point? Did I do acupuncture?
No, you're totally right. And the fact that you're saying you used a 25 gauge needle on a kitten, I don't know if everyone can see this.
You can't even see it because it's so tiny. We can see it because your hair is dark. So yeah,
my hair is dark. That is how small this is. This is significantly smaller than any person uses to draw blood from your pet at any time.
Yes.
So it's not animal abuse in any way. Some of the needles are bigger and thicker in horses, and the ones we use in elephants are clearly bigger. But this is here. I'm trying to put it in front of my hair again.
Yeah.
This is the size of needle I use in most cats and most small dogs. I use something just a tad bigger, sometimes a tad longer in dogs.
Yeah.
So this is as big as it gets. And look, that's as easy as it is to bend. There's no abuse here. That's Michigas.
Yes. Well, and I will say I'm one of those tattooed people that are scared of needles. And people say, like, how do you get tattoos? And I'm like, listen, it's a different story. And I did acupuncture, no problemo, right? Like you don't even, if people say like, it's like a bee sting, and then you're like, it's not even like a bee sting, because like a bee sting is horrific. It's like, it's not even bad. And then anyway, you don't feel it. And I will also say I've had the needles left in me and like been getting dressed and like knocked them and they don't even hurt. So like, you don't even know they're there. And what I want to say is as opposed to the benefit. So we heard from Anna, who had a cat with end stage cancer, and this made her comfortable. She was always better after the appointments. We had Cody say his cat didn't think he would tolerate it, but he actually fell asleep. How many times do your patients fall asleep?
They do. I would say half of them do. Half of them never accept it, which is okay. Because, I treat a lot of cats, and a lot of cats never accept anything you're ever going to do to them.
I love that, setting the standard at maybe.
Yeah. And there are some dogs that it's like, there's this one dog. Every time I see him, his name is Galahad. He's the sweetest lab. He starts snoring, And like after a while, I'm like, you know, buddy, I love you so much, but I have to go now. I'm sorry. I have
He's
to
like,
wake
you're
you
the
up.
best part of my
He's like,
week.
let's just hang out longer.
Can I just stay in the room? You don't have to keep acupuncturing me, but can I just take the best nap of my life?
Yeah.
Now, we did have Anne Marie ask also about what was that point for the seizure, just for fun, so we know.
Yeah, so it's a point in the ear. It's kind of hard to explain. I guess I can kind of use this. So here, if you look at the ear.
That's perfect.
If you look at the ear, if you flip the pinna down halfway and then fold it in half. So you're taking the pinna, which is the ear flap, and you're flipping it this way, and then you're also flipping it this way.
That makes sense.
Where the intersect is vertically and horizontally, that is a stop seizure point.
Wow.
So it's not always easy to find in every patient. Sometimes you draw blood when it happens. A lot of times in acupuncture, if you stick a needle in something and it draws a little bit of blood, it's a good thing. It really had to happen.
Yeah.
But
yeah.
It doesn't always work, but it did for Nelson that day. And I've done a couple other pets where it hasn't stopped immediately, but it stopped eventually, like within a minute or two. So yeah.
Yeah, like they say, the more blocked the point is, you may have more of a reaction at that point, right? But that's what needs to happen, and then you don't generally have it because you've kind of unblocked it, right? I mean, and there's real science. I think it's an interesting thing because some people argue, like, how can you explain wind and chi in the body? But there are actually like scientific backings as far as like neuro points and crossings. This is not just about water in your spleen and wind in your liver. It does have scientific backing, right? There is real science behind acupuncture.
Right. And so if you think about it, and Dr. Kosin, one of my mentors, always said, like, if you were making a medical scheme based on observation, because remember in ancient China, they didn't believe in opening the body. So the pancreas didn't exist 3,000 years ago. There's a lot of parts of us that didn't exist 3,000 years ago. When you go ahead and you start thinking and like based on observation, like, oh, you know, if you're really emotional and there's a lot of things going on in your life, you're not going to make good decisions. Your mind doesn't have enough room because it's too busy. So yeah, it makes sense that you're going to start having hypertension. Like we know that now. Like what's one of the number one causes of death in America? One of the number one causes is things that are secondary to stress, hypertension, cancer from chronic inflammation, which is from stress. Like all these things are from stress. So yes, that's one of those things that makes sense. Or, you know, if your liver's out of whack, you're going to have seizures. It makes sense. So that makes sense that that's the meridians we worry about in acupuncture. That and the gallbladder are the meridians we worry about with traditional Chinese medicine for seizures.
So to Haley's point here, she's wondering how it does for kidney disease, and you kind of mentioned it earlier, but can you talk a little bit to how this works for these diseases and why we target some diseases over others and what they can expect in terms of improvement? Are we expecting our numbers to change in blood work? Are we expecting better appetites? What can we expect when we are targeting certain diseases? I know that's broad.
It is. So why don't we try to stick to, let's try to stick to one type of cat, because one of the things I will say about acupuncture is if you think of two cats that have kidney disease, say one of them is very thin, not eating well, the coat looks really unthrifty, has real big flakes, drinking and peeing a lot, sitting in the sun, and you have another cat doesn't look as unthrifty. Maybe it doesn't have, maybe the coat doesn't look that bad. Maybe it's just not a little glossy. Maybe it's sitting in it doesn't want the sun. It wants the shade. Maybe it's drinking a lot, but it's not as thin as a rail. I might treat those cats differently because in traditional Chinese medicine, they might have different things that I have to focus on. You know, like if the one cat has no appetite, I'm going to focus more and do things that help with that. So why don't we just focus on kidney disease and like some older cats with kidney disease. So for kidney disease, as you're saying, Haley, one of the things, if your cat's not eating well, it should increase the appetite. It should also help the cat not get thinner. It should help if the cat's already like has that change in the breath. It should help with that. It should help with moving its blood. So if it's anemic, it should improve that. should improve hypertension. And I've had a lot of cats where I've reversed the numbers. You don't always, but to me, I don't care what the numbers look like if the cat's walking around eating, drinking, sitting comfortably.
So I guess what I hear you saying is it's not really maybe about the umbrella of the disease. It's good to know, but it's really about the symptoms the pet is experiencing. And that might be from week to week and not from overall, right? Because you might get the appetite going and then realize, something else has popped up that because you were so focused on the eating, you might not have realized this was going on or that was going on, right? So
exactly,
it's really about the in the moment and what the patient is experiencing, not what the disease has been labeled.
Right. So there's a cat in my book I talk about. Her name was Ellie, and we started acupuncturing her very early in her kidney disease. And then she wound up getting hypertension, and then she wound up getting hyperthyroidism, and things changed over time because Ellie changed over time. But Ellie also lived she was old.
Yeah.
Sweet little girl. She got really, I think she was 19.
Wow.
And yeah, it was pretty awesome. I think I treated her for 6 years.
That's what we all hope for, right? We all want 20-year-old kitties. Yes. I know.
If she wasn't treated, I don't think she would have lasted near as long.
Right. Or quality of life even of the years she had, right?
Right. So yes, Nadia, acupuncture can help pets with over and underweight problems. So if they're underweight because they're not eating, that's usually called a spleen qi deficiency. And we can do a lot of things to help with that. And that can also show that there's some underlying immunology issues going on. So we can help with that. And then if the pet is overweight, that's kind of a stasis sometimes. So we can help move the stasis and get them moving. That's why if you've heard of people who get acupuncture in their ear done and all of a sudden they lose weight, for certain deficiencies and excesses, we can treat that way.
What is, it's just so amazing to think of all the different things that you can treat. So tell me what else would you want people to know about acupuncture? When you bring new clients on, what do you tell them? What haven't we covered that our folks out there need to know about this? What I think is amazing option for a part of a complete therapy, right? We know that this is not always the independent answer. We know that it needs to be part of a comprehensive therapy. But I just truly am interested to know, what else we need to know about getting people out there and trying this.
So to me, because we're talking about cats don't have a placebo. But cats are also, as I said earlier, they're a species of prey and predation. So it is not uncommon for me to be at the cat clinic and me be they're he's just acting a little off. And I'm like, okay, well, let's do some labs. Then I get the labs back and I'm please go directly to the ER. Do not pass go. Do not collect $200. Go. You need a blood transfusion, or go your liver, or your kidneys.
Yeah.
Cats love to hide things.
Yeah.
So, if you have a cat that just seems a little slower, or just isn't sitting as high as it used to sit, or when you think about it, you're I haven't seen you flop on your back in a while, or you're leaving a little bit of food in your bowl, or you might be peeing more, but I'm not sure. Any small change in a cat might be a big deal. That's why it's so interesting and exciting and never boring to be a cat veterinarian, because these small little things might be a big deal, and you can do a lot with just a little. And acupuncture is a good way to do that. If you're just he's a little slower, I can help with that. I can help boost their chi, and maybe they start running around just after one treatment, or they're just painful. You can do a lot with that. Or if someone rescued a declawed cat or something, and you're just oh, your personality is changing right now, or something like that, and I can't, you won't take your meds because you're a cat. You won't let me get them in you, even though I've tried everything. I've tried flavored whatever and liquids, and you won't let me give you Adequan injections. We can't do anything. Most likely, someone can throw acupuncture needles in them, and they can treat them. And that can make all the difference in not only your pet's life, but the family is living in life, because all of a sudden you get your pet back.
Yeah, and maybe you have to see it to believe it, because I think that, if you are not a believer, just even ask for a reference, because there are so many people out there who will say and witness, like you just said, with tears in their eyes, my pet wasn't walking. We were looking at euthanasia, and that was a year ago or 2 years ago.
Yes.
Anna's wondering, how do you get them to sit or lay down during these sessions? Are they allowed to walk around with needles in them? What does it look like?
I let them do whatever they want. It's their special time.
Okay.
So there is one cat. Her name is Coco, and I love her very much. And I have to hold her the whole time, because if I don't, she reminds me of Toothless in How to Train a Dragon. It's just like, I've seen her fly around the room. So for that reason, I hold her very tight. But most pets, if they want to lay down, they lay. If they want to sit, they sit. If they want to walk around, they walk around. Once the needle's in, if it's been more than a minute and they pop it out, it's done. The cheek's out. That's what we had to do there. The point's done. So I just let them have their special time. I sort of think of it, even though this isn't a spa, I sort of think of it as like, if I was getting a spa treatment and I wanted to leave right now, I would get up and go. Like, it's their time. If they want to walk around, they can walk around. Because a lot of my patients have a lot of mobility issues. So if all of a sudden they are uncomfortable in a spot or something like that, I don't want to force them to do anything.
I love that. And we know that having an out is the most important thing for cooperative veterinary care. When they can learn and trust and say that I get to stay here, it's so important. So Diane asked this question that sort of reiterates that we've talked about. It depends on the cat in front of you. But what I wanted to ask kind of off of her question is, if a person's like, listen, I have financial constraints. I know I can't go every single week for 4 weeks. Is it better to go and have the experience once and do maybe once a month if you can afford it? Like, if there's financial constraints, is something better than nothing?
Yes.
Okay.
So some pets I will see once and then I magically cured them. Doesn't happen a lot, but that could be. Yeah. Also, if you have your pet treated once and you see that it made a really big difference, then you might be able to change other things you're doing for your pet in order to reallocate finances. Also, depending on what you're doing, like I had a case, like, since I'm mobile, I had one client who had 2 or 3 pets at their house, so they saved on the trip fee.
Yeah.
I mean, you just have to talk to people and see what they can do.
Yeah.
And a really good place to start would be to go to tcvm.com, which is a website you could go to find local acupuncturists that are certified. There's also people on there who are certified in herbs, certified in Tweenaw, which is massage, and certified in food therapy.
So that's tcvm.com, and they can find some folks that can help them in their area. And, it's about a conversation, right? It's just talking and learning, which is what you're doing for us today. I think, I feel like I learned so much from you, and I'm so excited about the way you convey it. I think too, also, you communicate really well. You believe in what you do, and you're great at what you do. And I was really excited for the opportunity to have this conversation and to get people more educated about alternative therapies for pets.
Well, if I can ever help anyone, you can follow me online. You can follow me on Instagram. You can follow me on Facebook. I try to highlight all my patients because they're the reasons I do what I do.
Where do we follow you on Instagram?
It's Acupuncture for Pets.
Okay, and what about Facebook?
It's the same. It's AcuVet or Acupuncture for Pets. And then my website is acuvetforpets.com.
Perfect. All right, guys, you guys know you want to follow her. You need to follow her. Do you show sessions on your social media?
Sometimes when my patients let me,
but
a lot of times I'm like kind of deep in the thought process. So I do it and then I take a picture after, but I'll see if one of my clients can tape it, because you know how it is with dogs. I remember when I took a speech class in college, they were like, you never give a speech with a live animal or a child. So you never know what they're going to do.
But all of America has learned that with the Zoom COVID life, right? Like, animals and children have been the highlight of every meeting I've had for the last 3 months. Oh, real quick too, Anne-Marie wants to know, what do you do in terms of, do you also, work with herbs, homeopathic remedies?
Yeah, that's a great question. So I dabble with herbs. with herbs, you really need to know what you're doing. And I know a few things. I started doing my herbal certification a couple years ago, but it's quite involved. And I have so much respect for those who do it. And I hope at one point in my life, I can, when my kids are a little bigger, I could do that. I did recently take an integrative veterinary oncology course. So I learned a lot of herbs for different types of cancers, which is, for me, even just since finishing the course, it's been a game changer. And I can't thank the Chi Institute enough for doing that, because it was phenomenal. And I'm so thankful, because already I've seen so much improvement from my cancer patients. So that's really great. And in terms of homeopathies, I do not know anything about homeopathies. I have someone locally I trust and refer, Dr. Jordan Kosin over at vhcnova.com. He is my master in this area. I just defer to him for a lot of things. And if I ever don't know what to do, he's so wonderful. I can call him, and him and his team help me out. They're so great there. So if you live in Northern Virginia and you want to do the whole gamut and you don't just want to do acupuncture, you go there. They are phenomenal.
Oh, I love it. And, honestly, I love, it's important to be able to say, I don't know. I don't do it. That's not my space. My hairdresser says, I don't do red. You ever want to be red? You got to go somewhere else. Like, I get it, right? Like, you're lane and you're in it. So thank you for that, because I would rather have the referral you trust, because I trust you, than you being a little unsure and dabbling where you don't want to go. So you are going to be part of the fun part of my show. I've covered a ton of information. This is my favorite part. You join me in announcing this week's winner of our Basepaws challenge.
Ooh, I'm very excited to hear about that.
My favorite thing. So every week we do a Basepaws challenge, and as the point is to make your cats happy, healthy, to prepare you for emergencies, and mostly to entertain me, because you guys tag me in your amazing pictures. So this week is Bal. You guys kill me with this. You got to give me the phonetics. It's Bali and is it Bali and Bali? And it's just spelled two different ways. You guys, I don't know. Give me the phonetics here. And what we did is we asked their meet cute, because I wanted to know how they met their pets and fell in love.
Oh,
and so we got
sweet.
The best stories about that. And then what we got to do here was to support. I asked them to tell me about pet adoptions, international pet services doing things for animals, spay, neuter, adoption events, what's going on out there that are getting pets home. And they were awesome to share what's going on and to tag what's going on in their events here. So I got their meet cutes. I got their events. I need their phonetics because I'm terrible. And honestly, you guys, I loved these stories. I love you guys. You make it the most fun to be a cat coach in the world. So thank you so much for that. This week's challenge will be up on Facebook, as it always is, with more videos from me telling you what we're doing, how to win prizes. This week's winner, you getting some swag. I think you choose a mug. I think you choose a mug or a shirt. I'll tell you, this mug right here, if you guys don't have this swag here, this mug will keep, I think it makes your coffee hotter. So if you need a good coffee mug, this one is it. It's in our swag.
I like that mug. I like the tail. That's so cool.
Don't we have the cutest little,
it's so
the opposite way. I love it so much.
It's
and like I said, this keeps your coffee really hot. And again, Dr. Erica, where can they find you? Give them the name of your book. Give them your podcast. Throw it at them one more time, because I know everybody wants more of you.
Sure thing. So the name of my book is Needles in a Haystack, The Unexpected Cure. You can find it on Amazon. My website is acuvetforpets.com. I am on Instagram at Acupuncture for Pets. I'm on Facebook at Acuvet for Pets. In case you couldn't tell, the company I own is called Acuvet for Pets, or Acuvet. And then our podcast is called The Litter Box. And you're going to hear, we have a whole host of different people. And I'm sure you will enjoy a lot of it. And hopefully it'll help you have a better relationship with your veterinary medical team and help with the questions you have.
I'm already enjoying it. I've enjoyed this conversation with you. Dr. Erica did a podcast with me over at Making Sense of Pets. We're just all about getting you out there. If you haven't followed the Cat LVT, she is awesome. She's actually, I think, coming to talk to Dr. Chris. We're doing an event with with the Cat LBT, we are just all about what you guys are doing and the education and help you're bringing and just getting this information out there. So,
well,
I
thank
can't
you.
thank
And
you enough.
if anyone's in Northern Virginia, we would be happy to see you here at Nova Cat Clinics, where all we do is cats all the time. And we were the first cat-only clinic in the area, and we are also the only cat-only clinic in the Beltway. So you can
Wow.
always find out more information. We have a pretty active Facebook community. It's Nova Cat Clinic.
Nova Cat Clinic over on Facebook.
Yep.
Erica, thank you so much. Always so good to hang out with you.
It's good to see you, and happy birthday.
Thank you. It's great to see you. Thanks for spending my day with me. Talking about
acupuncture. Be in perfect. Yeah. We could be in person, but that's okay. It will be eventually.
And that's it. And I'm just gonna take a rain check. We'll grab a margarita the next time we get together, a 6 foot away margarita. And you again, I can't wait to see you. Thank you for what you're doing. Thank you for all the information. You guys can find Dr. Erica all over social media. Throw your other questions at her. If there were any questions we didn't get to, we will absolutely make sure we get to them. Thank you again, Dr. Erica. We're going to see you.
Well, thanks for everyone's support, and I hope you all have a very happy and safe day.